Biostimulators versus fillers. What the hell is the difference? Look, let's define terms here. Fillers fill volume. They are substances we put in the face to fill. Biostimulators stimulate our body's production of collagen. Now, here are the nuances. There are some publications that would indicate that hyaluronic acid fillers do actually stimulate some collagen production, and there's also the fact that biostimulators stimulate collagen over time. That adds to volume.
So we have fillers that add volume and biostimulators that produce collagen. But what are they made of?
Fillers, the predominant filler that is used today is made of hyaluronic acid. So this is a typical syringe. Hyaluronic acid is a natural substance found in our body. The companies do things like cross-linking and various chemical treatments to make them behave differently, so fillers could be thought of as thinner or lighter. Calcium hydroxyapatite, which we're going to talk about in the other category, can be used in its pure form as a filler as well. Now, going on to biostimulators, one type is made of poly-L-lactic acid, or PLLA, and this has been found to stimulate your body's own collagen production. The other kind is calcium hydroxyapatite, and when diluted in various dilutions, this has been found to stimulate your body's collagen production as well. This one, calcium hydroxyapatite, goes by the trade name of Radiesse. And this one, the PLLA, goes by the trade name of Sculptra.
So we have all these amazing products. Why would we choose to use one over the other?
Yeah, we get asked that a lot. And you know, it really depends on the injector's goals, the patient's goals, and how you come up with a plan together. So if you want to think about it this way, hyaluronic acid fillers fill volume, so you see it right in front of your eyes. It's kind of cool. We love that magic moment in the mirror. So what you see is what you get to some extent. There is some settling. Biostimulators, on the other hand, you gotta have some patience. You initially see a little volume because there's water in them, but then it goes down. So this is a 6 to 8 week process, maybe longer, depends on the patient's own body's production of collagen. And sometimes with the biostimulators, it can take 2-3 sessions in a year the first time till you see some results. You have to cater it to what the patient wants and what you're looking for.
Okay, so somebody who wants a little bit more of an immediate result, that instant gratification, filler will probably be a little bit of a better choice for them.
Or if you're like a really impatient surgeon like me, you know, like, come on, let's fix this.
Let's do it.
No, I use biostimulators. I just want to say, I have been known to, you know, God grant me patience and I want it now.
Yes.
No,
sounds like there's definitely a place for both. So both of these products are considered injectables. Are they injected in the same way?
Good question. The answer is they can be. Hyaluronic acid fillers can be placed either using just a needle like this. They can also be placed using something called a cannula. And I'll put a cannula on here. And the difference between the needle and the cannula, as you can see, is that this cannula has actually got a blunt tip and it's more flexible.
You wouldn't want to do that on the needle.
No, don't try that at home. Biostimulators can be placed with a needle, but it's more common to place these with a cannula. And just for sake of clarity, this gets reconstituted, or sterile water is placed in here, and then we put it into a syringe. We don't directly use it through the bottle, we just wanted to demonstrate that.
So it looks like we can do a lot of things with filler and biostimulators. Are these products used in the same areas of the face? Are they used in different areas? Tell me a little bit about that.
Yeah, well, when it comes to the face, really, with hyaluronic acid fillers and fillers in general, we can go anywhere from the top of the forehead down to the chin. With biostimulators, there are a couple of areas we don't use for the face. One is the lips, because there's more chance of getting nodules with biostimulators there. We also don't use biostimulators in the very, very thin skin around the eye or in the very, very thin skin covering the nose. There's just not enough subcutaneous tissue to get the fibroblasts to produce collagen, because the biostimulators need to be placed in a layer where these cells called fibroblasts are, and if there's just really thin tissue, there's not much there. Truthfully, you wouldn't use a biostimulator in the forehead for the same reason. There's just so thin before you get to the muscle and the bone, there's just not enough subcutaneous tissue in that area. But all the other areas we would.
Okay, that makes sense. As with anything in life, everything comes with certain risks. When we're talking about fillers and biostimulators, what are the differences between the two?
Sure, there is no perfectly safe place on the face. There is no perfectly safe product. However, you can do things as safely as possible. But there are risks. You know, one of the biggest risks, well, the biggest risk that injectors think about is vascular occlusion, also known as a VO. And this is when a product gets placed into an artery, it blocks up the blood supply to the tissue that the artery supplies, and eventually that tissue doesn't get oxygen and the tissue can die. It can cause blindness. It is a very rare occurrence. It's extremely rare to begin with fillers. It's even more rare for any of that stuff to happen with biostimulators because they're more dilute. So even if you get into an artery, there's less chance of blocking, but there have been reports. So in general, that vascular occlusion risk, while it's small overall, exists more for fillers than biostimulators. Nodules are something where you get a lump in your face, and nodules have different reasons that they form, inflammatory and early versus delayed. They are something that can be difficult and challenging to deal with. They can be dealt with. In the early history of Sculptra, there were some reports of increased nodule formation, but we found out that the dilutions were probably not enough. And in the current era, with higher dilutions, more massaging of the area, it's even less chance of getting nodules with that. But any of them can form nodules. And then of course, a poor aesthetic outcome can happen with any of these. And you also have the temporary kind of things that you could expect from putting a needle in someone's face or a cannula, bruising, swelling, that type of thing. So those are the main things that we think about with that. Infection can occur with either. It is certainly a lower risk. It's not zero, nothing zero, but definitely a lower risk. Temporary discomfort is also something we got to consider.
I mean, that makes sense. You're putting needles in someone's face, so I would expect a little discomfort after that.
It can happen, yeah.
So we have two amazing products here that are doing all kinds of great things. Which one lasts longer? I mean, that's definitely something that people want to consider when making their choice.
Yeah, so this is going to be, there's a range here. In general, if I give you kind of the ballpark, people feel like biostimulators are more like 2 years and beyond because it's your body's own natural collagen, versus fillers that do get degraded, although we're finding out they last longer than we think sometimes. But fillers, depending on the area of the face, whether there's a lot of motion, what type of filler, it could be shorter than a year, it could be a year to 2 years. Some of the new products, maybe 2 to 3 years, but in general, the feeling is that the biostimulators are more graceful, natural, slow approach, but they last longer. Keep in mind though, with biostimulators, it's stimulating your body's own production of collagen, but in 2 years, you're gonna be 2 years older. So we continue to age. Bad news, I don't wanna burst anyone's bubble, but our skeleton, our skull starts coming less, our fat pads deplete and fall down, and all kinds of stuff happens. So, you know, they last longer, but your collagen is getting degraded too. So, you know, you have to have realistic expectations. So in general, biostimulators a little longer, perhaps is the general feeling, than fillers.
So I am absolutely loving what I hear about both of these products, this filler, this biostimulator stuff. So are these used together?
Yeah, you know, we absolutely can use these together. I love that approach. So often patients come in, they either want their cheek contoured or they have a lot of volume loss. You could start with either, but I often start with a filler, give them that result they're looking for, that they came in for. But as you know, I'm a big fan of not putting too much filler in and waiting. So I will talk to them about a longer term plan where they come in and get one of the biostimulators, maybe just one vial for the year, maybe 2 or 3 times, but it's a great long-term plan instead of constantly putting filler. So you got that immediate pop, but then you have this longer term plan where they're building their own collagen. So I love that. And there is a product called Harmonica, which combines hyaluronic acid filler with some calcium hydroxyapatite. However, we don't have it here in the US yet. So as of this date, we don't, but we will. So that will be another tool in our toolbox We can add to the filler armamentarium. I love that word. And it'll be just another way to help our patients, gain confidence that they want to do, because that's the goal.
That's the goal.
Yeah.
So what is post-care like for filler versus a biostimulator?
There are a lot of similarities, but there are some major differences. For post-care with fillers, we tell patients not to massage their face and avoid things that are going to put heavy pressure on their face. On the other hand, for biostimulators, we actively want them to massage their face in terms of getting the product distributed. So we want them to be moving the product around, and we'll ask them to massage like 5 times a day. With one of the products, it's 5-5-5. 5 times a day for 5 minutes a day for 5 days.
The rule of fives.
The rule of fives. And so wherever the biostimulator has been placed, you want to gently massage that and try to make sure that that product doesn't get in one single area. It's thought to help decrease nodular formation. So those are the big differences. Both involve putting a needle or cannula in the face, so we tell patients maybe don't exercise vigorously for like 24 to 48 hours. We also tell them to avoid extremes of heat, maybe take it easy the rest of the day. With fillers especially, I'll tell patients not to have any dental work or vaccines. The dental work for 2 weeks, because it can get bacteria in the bloodstream, and the vaccines can stimulate your immune system. It's really not as much of a problem with the biostimulators. So similarities and differences, and certainly the risk of vascular occlusion. We always tell patients to call if there's anything weird, they think anything's going on, and that goes for either of those.
So are there any other things that we haven't talked about yet?
There is one I think of. The biostimulators, we will use them in body parts off the face, such as the neck, the décolleté, the elbows where we get crepey skin, behind the knees where we get crepey skin, the thighs, the buttocks, and the skin. And
wait, did you say in the buttocks?
Well, yeah, both superficially for cellulite and things like that.
Okay.
But we also can do a non-surgical Brazilian butt lift, as they say, the BBL.
Okay.
And you can use either of these products, the Rêvée Aesthetics or the Sculptor, people do that, to augment the buttocks or take care of hip dips and things like that. And so we don't typically do that with hyaluronic acid. So that's one more difference that we could mention.
I didn't know you could do so many things with these biostimulators.
It's amazing. So look, it can seem a little overwhelming, but I like to think of these as fillers, fill volume, biostimulators stimulate. It is nice to have options. They fit together nicely. You always want a long-term plan rather than just quick fixes. The direction I think things are going are more towards natural stimulating your body's own production of things. So it's great to see this trend, and just keep in mind that they're both great tools. It just depends. You need to get an individualized consultation. You need to have someone you trust, and then go have fun.